Hi everyone and welcome to this test and discussion of microbiology on the Unacademy platform. I'm Dr. Preeti Sharma. I'm your educator for pathology and microbiology on this platform, and I hope the next few questions which we had put up in the test, all of you were able to attempt, and that quick discussion that we're going to have on it right now, I hope it turns out to be beneficial for all of you. So let's get going right away. We'll start with a very simple one-liner kind of a question, and this was the question that was given to all of you. What is the most common cause for the lower RTI, respiratory tract infection, in children below 1 year of age? So yes, it's very obvious. The age is the deciding factor over here regarding LRTI. And the correct answer to this question was, out of influenza, para-influenza, respiratory syncytial virus, and coronavirus, with corona obviously coming in every option going forward, the correct answer for this age group will be the RSV, that is the respiratory syncytial virus. Now, what are the quick points that you have to know about RSV? Please remember, in terms of epidemiologically, this is very common in the rainy season, number one. It goes on from an age group, the usual age group, like we said, under 1. So it starts from 6 weeks to 6 months. The maximum cases are seen in that age group, but for all purposes, less than 1 year of age. And it has two subgroups, that is RSV type A and B, out of which A is the one that causes a lot more severe infection than RSV B. That's regarding the epidemiology. So like I said, the most common age group that is affected is under 1 year age group, and infants, that is, and this is one of the most common cause of lower respiratory tract infection in this age group, and that is the reason that this question was given to us over here. In adults also this can cause respiratory tract infections, of course that is there, but most of the chances of you getting a question will be on the infantile age group. Well, now let's talk about the real microbiology part, and that is the lab diagnosis. How are we going to do the diagnosis of this patient? So like any other virus, for viruses, what's always beneficial and best is going to be the cell lines. So in the cell lines, the HeLa and the Hep2 cell lines are used. I hope all of you remember these cell lines. These were the continuous cell lines that you must have studied, the continuous cell lines. So if you remember your general virology well, there are three types of cell lines: primary cell lines, secondary cell lines, and continuous cell lines. This falls under the continuous variety, means it allows unlimited cell divisions. That is the meaning of continuous cell lines. It allows unlimited cell divisions. Well, having said that, now we know that okay, we are talking about the virus isolation, which is HeLa and Hep2, but did you give it a thought that why did I label it as respiratory syncytial virus? I've understood the reason of calling it respiratory because that is what it causes. I know it's a virus, but what is the reason behind calling it syncytium? Because for viruses, all of you must have read, can you see a virus under a light microscope, under a regular microscope? You cannot. So we would not be able to see it on a light microscope. Then how will we know that the person is suffering from this virus? When we'll see the changes in the cells that it has caused. It has definitely caused certain changes in the cells, and those are referred to as what? Those are referred to as the cytopathic changes. Those are referred to as cytopathic changes. And what's the cytopathic change that you see? Syncytial effect. What is syncytium? If you go by the basic definition in English of syncytium, it means a group of cells, or it basically means that all the cells have fused. They have formed something known as a multinucleated giant cell. So that is the reason of calling it syncytium, because when someone is infected with this virus, the child develops these kind of cells, syncytial multinucleated giant cells. Well, giving you all the information about it, the question out here was quite clear cut. That is option 3, RSV. Let's move on to the next question. Talking about question number 2, let's read it. The unique gene called TAX gene is seen in which of the following viruses? HIV, HTLV, HPV, or hepatitis B? So I hope all of you remember that TAX gene is something very famous for HTLV. Firstly, what is HTLV? If we want to know the full form, it is a human T cell leukemia lymphoma virus. That is what, and it's very obvious what is it going to cause. It's a human T cell leukemia lymphoma virus, and because God, everything about it is to do with the alphabet T. So you will say, okay, this is a virus that is infecting the humans, and what is it causing in the humans? It's causing leukemias and lymphomas. Of which category? B cell or T cell? It's causing leukemias and lymphomas of the T cell. So what disease do you know that as? That is known as ATLL. What is ATLL? Adult T cell leukemia lymphoma. So what is the disease caused by HTLV? This virus causes ATLL via which gene? Now the gene responsible for this is definitely going to be the tax gene. So that is the question that was given to all of us, and that is what you had to crack over here. So if I ask you that, okay, now you know the gene, what does this gene actually do? What is the effect, or what exactly does tax gene, or what is it responsible for? So it does 2-3 things which I just want you to quickly go through. First and foremost, you will say, ma'am, I can see something called CDK activation written. Now when they say CDK, what does it remind you of? Cyclin D or cyclin dependent kinase. You'll say, okay, this is something to do with the cell cycle. This means it's going to help in moving forward of the cell cycle, and that makes sense. The cell is going to divide and divide and divide, means cancers honge, leukemia, lymphomas will occur. So I understand that the tax gene causes CDK activation. Next, it is going to activate the telomerase, TERT gene. Telomerase, do you remember from your general basics that telomerase is something that is going to make a cell immortal? It is going to make the cell amar. It is going to make it immortal, which basically means that the cell is going to survive forever and ever, again leading to what? Leading to leukemias and lymphomas. And also this activates which pathway? Tax gene activates NF-kappa B pathway, and NF-kappa B pathway will cause activation and growth of particularly which cell? Of the T cell. So now you are able to understand why it is always causing these T cell leukemia lymphomas. So these are the 3 primary modes by which tax gene acts. Number 1 is CDK activation, number 2 is activation of telomerase or TERT gene, and number 3 is the activation of the NF-kappa B pathway. So the disease I've understood, the disease that it's going to cause is adult T cell leukemia lymphoma. But if they ask you that what are the cells that you see in adult T cell leukemia lymphoma, these are the kind of cells. What sample is this? This is a peripheral smear. How do I know this is the peripheral smear? Because I can see these red color cells called the red blood cells. I can see these tiny little dots which are referred to as the platelets, and then I can see these kind of cells, and if I look at these cells carefully, they are looking, the nucleus is looking convoluted, or you can say the nucleus is looking like a flower. So this is known as the clover leaf cells, and that especially students who are preparing for INI-CET should keep this question in mind, that where do you see clover leaf cells? Clover leaf cells are seen in which leukemia lymphoma? Adult T cell leukemia lymphoma caused by HTLV virus, and the gene responsible for it is going to be the tax gene. The D gene, as we've just studied, is going to be the tax gene. So yes, I think that wraps up my question. HTLV is sorted, but then when I look at the other options, I've got HIV. HIV is not related to one gene. It is related to obviously a lot of immunodeficiency. It's an attack on the CD4 that is going to be done, which everyone knows. When I'm talking about hepatitis B, there is a gene called the HBX gene which is responsible, which is easy to learn. Hepatitis B, so HBX gene. Versus when I'm talking about HPV, what is about HPV that you should be knowing for the exam? When I'm talking about human papilloma virus, firstly, I need to know the mechanism. Second, I need to know the cells. So remember, human papilloma virus has 2 very important proteins called the E6 protein and the E7 protein. The E6 protein and the E7 protein, and please remember the E6 protein is going to go and inactivate the policeman. Who's the policeman of the genome? The P53 gene is going to be inactivated, whereas the E7 protein is going to go and inactivate whom? The RB gene. So do you know their other names? These are 2 very, very important genes of our body. P53 gene is what? P53 gene is said to be the policeman of our genome. He's a protector. P53 is a protector. And HPV is going to chuck out the protector. So big problem for us. E7 is going to chuck out RB gene. What is RB gene? RB gene is said to be the governor of the genome. Imagine governor, such an important and official person, and E7 is going to go and chuck that out. So are we in for big trouble if the policeman is gone, the governor is gone, of course we are in for big trouble, which means we will end up with multiple cancers. Like in females, everyone knows cervical cancer. In males, everyone is aware of penile cancer. In both males and females, everyone is aware of anal canal cancer. Nowadays, even esophageal cancer, laryngeal cancer, all of these cancers have been associated with HPV. Basically, how have I learnt it is human papilloma virus. Do you see something common in the cervix, penile region, anal canal, esophagus, and larynx? Their epithelium. I can definitely see something common in all of them, and that is going to be the squamous epithelium. So HPV tends to have a predilection. HPV particularly goes to go and involves the squamous epithelium wala regions. Finally, what are these cells? I've got you two pictures. This picture on the left is actually a cervical cancer, so pap smear photo has been shown, and this is a biopsy picture that has been shown. In both the photos, if I try to draw it, if this is the cell, I see the nucleus is very dark and irregular type. It's not a round nucleus. So how do we define it? We define it as a raisonoid nucleus. It is defined as a raisonoid nucleus. And if you see, look at this, look at the nuclei, they're really dark and weird shaped. And there's a white area around it. Around it, I've not made any color. There's a white area around it, and that is known as a perinuclear halo. So please remember, these two words are going to be there. That is known as a perinuclear halo. And what is the name of this cell that we are describing over here? This cell is said to be a coelocyte. This cell that we have just now described is said to be a coelocyte. So they will ask you that with human papilloma virus, which is the cell that you see? That is a coelocyte. So this cell is a coelocyte on a pap smear. These cells are coelocytes on a biopsy. So yes, those can be questions with regard to the other options mentioned. Let's move on to the next question, guys, which happens to be this. A special type of media that contains an indicator which helps to identify the bacteria by a color change. Some indicator which helps to identify bacteria by a color change. So basically they're wanting to ask you which of the following is an example of an indicator media. So let's go one by one. What do you know about Stewart's media? I know that there's something called Stewart's media, and something very similar to Stewart's media is the Amy's media. Where do we use this? These are not indicator medias. These are said to be transport medias. They are used in the transport samples of which particular bacteria? For Neisseria. They are used in the transportation of Neisseria. Talking about RCM, Robertson's cooked meat broth. Robertson's cooked meat broth is an anaerobic bacteria media. Whenever you want to grow some anaerobic bacteria, you are going to use Robertson's cooked meat broth, and a very famous example for it is Clostridium tetani, Clostridium perfringens. Okay, coming to the next, we have something called McConkey agar. McConkey agar is a lot of things. Firstly, McConkey agar is said to be a differential media. I'll be showing you a picture also of McConkey agar. McConkey agar is said to be a differential media because it tells me a difference. What difference does it tell me? Between lactose fermenters versus non-lactose fermenters. It tells me a difference. Next, this also happens to be coming under the category of selective media because it's selectively going to grow some organisms and not the others. So it's a selective media, and this also is said to be an indicator media. What do I mean by an indicator media? It's going to indicate a color change. Whenever I'm going to talk about a color change, that means it's indicating something. So let me show you a picture of a McConkey agar. Why do I first and foremost? There's a very famous question that comes up that when you're talking about the McConkey agar, what is the composition? So there's a very famous mnemonic which I think everyone knows by now, that goes by the name of plant, right? So everyone, quickly we can revise. What all does it contain? It contains peptone, then it contains lactose because I want to find out lactose fermentation. Then it is an agar, so it has to contain that. It contains neutral red, and that is what is going to change the color. If you ask me what is the indicator that you have in this media, why are you calling it an indicator media? Because it's a neutral red. And lastly, we have something called taurocolate. We have something called taurocolate. So is this going to be an indicator media? Yes. And if the color is going to change to what color? The color turns out to be pink. That is when I call it a lactose fermentation. When the color turns out to be pink in this case, right? So you can see the pink color, that's lactose fermentation. So I could have selected over here McConkey, but when I saw the first option was McLeod's medium. Now what is McLeod's medium? So now I'll be able to tell you what an indicator medium is. Indicator medium is that whenever the bacteria will grow in it, the color is going to change. So there are two media that should come to your mind that is coming under indicator medias, and these include the Wilson-Blair media. Wilson-Blair media is basically for typhoid. It is for typhoid, and you can see it's giving you these black color colonies. And we have something called the McLeod medium. McLeod medium is something that we use for, if you know the other name, it is potassium tellurite agar. Potassium tellurite agar, you will say, now I know. Potassium tellurite agar is a very famous media that we have for Corynebacterium diphtheria. So remember the two main indicator medias which are the most famous examples: Wilson-Blair for typhoid, McLeod's for Corynebacterium diphtheria. So my best answer over here is going to be the McLeod's medium. Okay, having said this, let's move on to the next question. An HIV infected individual presents with plasma cell pneumonia. What is the most common cause? If I can write plasma cell pneumonia, PCP, if I label it as PCP, plasma cell pneumonia, you know I have again learnt the PCP in another manner. Rather than plasma cell pneumonia, I call it pneumocystis carinii pneumonia. Pneumocystis carinii pneumonia. That is what I refer to it as, pneumocystis carinii pneumonia. So the best answer over here is going to be pneumocystis. And does pneumocystis happen in HIV infected individuals? Yes. In fact, everything mentioned over here can be an opportunistic infection. So how does the patient present? For pneumocystis carinii pneumonia, firstly, it will be a seropositive HIV positive person, and the patient is going to have dry cough. It's not cough with expectoration. Usually patients have a dry cough. So are you going to get a sputum sample? No. Chances of getting a sputum sample are not likely. Usually you will be going in for a bronchoalveolar lavage. When you go in for a bronchoalveolar lavage, the kind of sample that you get is a very frothy, with bubbles, frothy kind of a sample, and which is the cell which is going to be very, very rich in it. It's going to have a lot of plasma cells. Now you understand why pneumocystis pneumonia, PCP, is also known as plasma cell pneumonia. So PCP, that is how I learn it. Which cell will you see? Plasma cells. But where is the organism? The organism seen is this. Firstly, why is the organism coming out to be black? Because this organism is not stained by the usual Gram stain and all. No, it's not picked up by the Gram stain. It's picked up by a stain called Gomorrhe's methenamine silver stain. It is picked up by a stain called the Gomorrhe's methenamine silver stain, and my concept tells me that wherever the word silver is going to come, that is when I'm going to get a blackish color. So that is why if you look at this very, very carefully, you will realize the shape. It looks as if it's crushed. Over here also it's crushed, over here it's crushed, over here it's round. So the appearance given to it is referred to as the crushed ping pong ball appearance. This is referred to as the crushed ping pong ball appearance, and other authors have given it other names. Some people call it that it looks like a hat. Some people say that it looks like a cup and saucer. So a lot of different names have been given to it, but the most commonly asked name is the crushed ping pong ball appearance, and that was your question. So repeating, plasma cell pneumonia will be pneumocystis carinii pneumonia. So the best answer in this case was option C. Starting with the next question. Here you have a 23-year-old man from the US who's come to India for a trip. On day 7, he had abdominal pain and diarrhea. Stool culture has grown in E. coli that has been described to you. And what is the most common cause of traveler's diarrhea? So you have a lot of organisms, all of them are E. coli that are mentioned. So let's try to work it out. When I talk about, these are abbreviated, like enteropathogenic E. coli is EPEC, enterotoxigenic E. coli ETEC, enteroinvasive E. coli, EIEC, and enterohemorrhagic E. coli, EHEC. So my concept is that traveler's diarrhea is caused by toxigenic E. coli, T for T. So the correct answer over here is going to be ETEC. However, I'm going to make you go through and rush through all of these different types, or I can say the different types of E. coli that are important in the exam. So like I said, the first one is enteropathogenic E. coli. This also causes diarrhea, but which kind of diarrhea? It causes infantile diarrhea. What do I mean? How do I learn this? P for pediatric. P for pediatrics. So EPEC, enteropathogenic E. coli, causes pediatric or infantile diarrhea. Next, enterotoxigenic E. coli, T for T. This causes the traveler's diarrhea. And how is this bacteria going to attach? So for example, if this is the intestine, how is the bacteria going to attach onto the intestine? So for the attachment of the bacteria, it has something called CFA. What is CFA? CFA means colonization factor antigen. How have I learned that? It's very, very simple. See, whenever you travel, why do you travel? Because you want to explore a new place. You want to go and find out what is their culture, or how are the people, how is the food, how is their overall environment, how do they live, basically how is their colonization. So when we travel, we are interested in knowing about the colonization. So remember, for traveler's diarrhea, it is going to be ETEC, and it's the colonization factor antigen which is responsible. Coming to the next, we have something called EIEC. Very simple, enteroinvasive. If I have invaded, this bacteria is going to invade into the cells. How can something invade into the cells? For example, if these are the cells, how will it invade into the cells? It must be having a lot of virulence. This means invasion is going to occur by VMA, virulence marker antigen, and if it's invaded, it's going to cause bleeding. So it's not just simple diarrhea, it's going to cause dysentery. So let's do a quick recap of all these points. Please remember, when we are talking about EIEC, enteroinvasive E. coli, if it has invaded, it will cause bleeding, that is dysentery. If it has invaded, means it has a lot of virulence, it has virulence marker antigen. Coming to the next, enterohemorrhagic E. coli, EHEC, something that is again going to be associated with all hemorrhagic kind of things. Hemorrhagic means bleeding, blood vessels. So which cells is it going to attack? What is the lining of a blood vessel? Lining of a blood vessel is referred to as endothelial cells. So it's going to attack the endothelial cells, and for this, I want all of you to learn one strain which they will ask you a lot, and that is O157H7. This strain has been asked a lot, that which is the strain of EHEC that is responsible for what? All the hemorrhagic thing, like H for HUS, hemolytic uremic syndrome. So hemolytic word has come. And second one, hemorrhagic cystitis. So remember, enterohemorrhagic E. coli is responsible for hemolytic uremic syndrome and hemorrhagic cystitis. So remember, O157H7. The next point, EHEC has a lot of questions. It has a low infectivity dose. So now you will say that, ma'am, can you give me a list of everything in parasitology or in microbiology which has a low infectivity dose? When I'm saying, they are asking me regarding low. So can I say, instead of low, I can say you are trying to ask me about small infectivity dose. And for that, I have made a mnemonic, and that mnemonic is chota small. That mnemonic is chota small. What do I mean by chota small? C is going to be Cryptosporidium parvum. C is going to be Cryptosporidium parvum. H is going to be Entamoeba Histolytica. H for Histolytica. H for what I'm teaching you again, enterohemorrhagic E. coli. So the next H for EHEC, and then in chota small, lamb, if you read it opposite, it sounds like lamblia. So that is going to be Giardia lamblia. Please remember, these are the organisms that require a small infectivity dose: Cryptosporidium, Histolytica, EHEC, and lamb, that is Giardia lamblia. Okay, having said that, coming back, so EHEC over here has a small infectivity dose. Coming to the next one, enteroaggregative E. coli. Everything about aggregative. So you will say, ma'am, when there's a lot of aggregation, like all of us today in this class, we have all aggregated and we are looking at this video. Whenever there's a lot of bulk of people involved, we'll make an impact, right? So when there is aggregative, it's going to make an impact. What is the kind of diarrhea that it will cause? Persistent diarrhea. Persistent diarrhea by enteroaggregative E. coli. And if you try to grow enteroaggregative E. coli on a cell line, that is the Hep2 cell line, you'll get aggregation. Means it will look as if they are stacked. It gives you the stacked brick appearance. So what are the questions that you get? Enteroaggregative E. coli, when they aggregate, they make an impact. So persistent diarrhea. And on Hep2 cell line, they show you the stacked brick appearance. Lastly, coming down to diffusely adherent E. coli. This sounds a little different, but as I said, diffusely adherent means it's going to diffusely adhere onto the surface of the cell. So if you look at all of these E. coli's once again, enteropathogenic is going to cause the pediatric diarrhea. Toxigenic is going to cause traveler's diarrhea. Invasive, because of invasion, it will cause bleeding, so there's dysentery. Enterohemorrhagic will cause all hemorrhagic things like hemolytic uremic syndrome. Aggregative means it's going to aggregate and cause persistent diarrhea. It's also going to result in the stacked brick appearance. And diffusely adherent, it's going to cover the surface diffusely. Well, having said that, now let's move on to the next question, and I hope this one was an easy one. They were just asking you about traveler's diarrhea, so ETEC is going to be the best answer, enterotoxigenic E. coli. Coming to the next question, let's read it together. There's a 28-year-old healthcare worker who had repeated episodes of abdominal pain and antral gastritis was found. The urea breath test was performed and is found to be positive. As soon as they say the urea breath test, are two very classical things. Firstly, the urea breath test is positive, so they are talking about an organism which is urease positive organism, and that organism is causing antral gastritis. So I think only one of them is going to come to my mind regarding gastritis, and that is Helicobacter pylori. So I don't think this question requires much of an assistance out here. But when I talk about H. pylori, the kind of questions that I'm going to get is what are the things that H. pylori causes? Broadly, if I tell you, number one is written in front of you. H. pylori, this was the question, it causes gastritis. Which part of the stomach is most commonly affected? The antral gastritis or antrum is affected. Later on, it can result in peptic ulcer disease because gastritis can cause peptic ulcer disease. Other than that, it can cause two cancers again in the stomach only. One is the stomach adenocarcinoma that it can lead to, and one is a stomach lymphoma. What is the lymphoma of the stomach known as? That is known as a maltoma. So repeating, we have gastritis, peptic ulcer disease, adenocarcinoma and maltoma. And they will ask you that how is it causing cancers? How is H. pylori causing cancers? Because God has given it two very magical substances called CAG-A and VAC-A. CAG-A and VAC-A are two molecules that God has given it, which is making it cause cancers. That has also been a question. Finally, you say that you want to identify H. pylori with the help of a special stain, and that special stain is the very, very famous WSSS. What is that? It is the Warthin Starry Silver stain. The Warthin Starry Silver stain. And again, coming back to my concept that if I know that I've used the word silver somewhere, the color that I'm going to get is black. So what is the color that the organism has got up? The organism has got a black color in this scenario. So Warthin Starry Silver stain. Now for students who are going in for INI-CET, Warthin Starry Silver stain has two uses. One of them is there in front of us, that is H. pylori. There's one more organism that can be stained by Warthin Starry Silver stain, and that is going to be Bartonella henselae. That is referred to as Bartonella henselae, the one that is causing that cat scratch disease. Yes, so cat scratch disease, H. pylori, both of these, they are stained by a common stain called the WSSS. Okay, having said that, let's move on to the next question that we have, which is this. Intestinal amoebiasis may lead to liver abscess. I know that. So which intestinal amoebiasis are we talking about? They are asking you that only. Which of the following regarding amoebic liver abscess is true except? So now remember that you have to go true and false. Firstly, when they are talking about intestine and liver, they are talking about a common organism, that is Entamoeba Histolytica. Because I know that Entamoeba Histolytica, firstly amoeba hai, that part of it is done. This can involve the intestine also, this can involve the liver also, yes. And in the liver, does it cause something very common? When I talk about Entamoeba histolytica, it usually affects which part of the liver? It affects the right lobe of the liver, and which surface? Posterior superior surface. Entamoeba histolytica tends to impact the right lobe of the liver and the posterior superior surface. And look at this, what is the color of the liver going to become? It's a very famous appearance known as the anchovy sauce appearance. It is a very famous thing called anchovy sauce appearance, this brownish color that has come out. And do you know what do we do for the diagnosis of this? If you get this, what are you going to see under the microscope? Which form of entamoeba are you supposed to see under the microscope? Trophozoites are characteristic. Remember, for liver only, I'm not talking about intestinal amoebiasis. I'm only talking about the liver aspect. How do we do the diagnosis of liver amoebiasis? By looking at which form? By looking at trophozoites. Where do we look at trophozoites? In this pus, in this anchovy sauce pus that you're talking about. So remember and learn it by heart that for the diagnosis, you have to see trophozoites in the pus. It has no relationship with the stool because you're talking about liver. If you would have been talking about intestinal amoebiasis, then I would have told you take a stool sample. So coming back to the question, first, let's go opposite. When I'm talking about amoebiasis, it rarely affects brain, eye and skin. Yes, these are very rare sites. That's kind of correct. Okay, is it more common in males than females? Now, you know, these kind of things are always something you might not know or might know. So, like, for the timing, let's keep it as a question mark. Is it mostly asymptomatic? Yes, that is correct. See, amoeba, most of the times we are able to fight it and we are able to eliminate it out of the body. So, most of the cases are actually asymptomatic. For the diagnosis of amoebic liver abscess, trophozoites in the stool are essential for the diagnosis. I definitely know this is false because I just told you that when you're talking about liver abscess, you don't need trophozoites in the stool. You need trophozoites in that pus that has come out of the liver, the anchovy sauce appearance. So trophozoites are essential to be seen there. So remember, for the diagnosis of Entamoeba histolytica in the liver, you have to see trophozoites in the pus. Whereas for the diagnosis of intestinal Entamoeba histolytica, you can see trophozoites and cyst in the stool. So do you want to also quickly revise how do the trophozoites and the cyst look like? For Entamoeba histolytica, this is a trophozoite, this is a cyst. Let's quickly revise the features. Trophozoite, point number 1, you will see that it has a pointed pseudopodia. There are 3 points that you have to analyze over here. It has a pointed pseudopodia. The next thing that you need to know is it has eaten up something. What has it engulfed? It has engulfed red blood cells. So can I say it is showing you erythrophagocytosis? It is showing you the presence of erythrophagocytosis, means RBCs are going to be eaten up. And finally, look at the nucleus. If I draw the nucleus again out here, where is the karyosome? The karyosome is in the center. That is another very important point. There is a central karyosome, and these are the points for a trophozoite. Repeating, the pseudopodia is pointed, RBCs are eaten up, so erythrophagocytosis, and a central karyosome. That is a trophozoite. Go to the cyst. How many nuclei can you see? You can see a total of 4, right? So there are 1 to 4 nuclei that we see in a cyst. And I see something very big and thick, and this big and thick thing is known as a chromatoidal body or a chromatoid body. So a lot of questions will come to you regarding what is a chromatoid body. That's also a question that has come up in the exam. What is a chromatoid body made up of? It is made up of ribonucleoprotein. Chromatoid body is made up of ribonucleoprotein, and if you want to know the stain for it, it is stained with hematoxylin. Hematoxylin is going to be the stain for a chromatoid body. 2 very important and previous year questions. Made up of what? Ribonucleoprotein. What is the stain? It is the hematoxylin stain which gives it a color, and it's a single thick body. Let's have actual pictures also. Can you see? Firstly, the trophozoite form. What do you want to say about the pseudopodia? The pseudopodia is pointed. You can see the nucleus over here, and you can see something eaten up. Maybe it has engulfed a red blood cell, erythrophagocytosis. Coming to the next one, cyst form. I can see 1 nucleus because cyst can show you total 1 to 4. So 1 nucleus, and I can see a very thick bar over here, which I would want to call as the chromatoid body. Repeating, made up of what? Made up of ribonucleoprotein. Well, so this question is also sorted. The false statement out here was that for amoebic liver abscess, I don't have to look at trophozoites in the stool. I have to look at trophozoites in the anchovy sauce pus. Okay, now going forward, we have two questions which are just plain simple one-liners, 2-3 of them. This is one of them, that which of the following disinfectant is used in the moments of WHO in hand hygiene. So the WHO has obviously given you 5 very important moments of hand hygiene. So which is the disinfectant that WHO has proposed out of isopropyl alcohol, ethyl alcohol, chlorhexidine and cetrimide? The answer to that question as per the WHO approved one is going to be ethyl alcohol. So like I said, for hand hygiene and hand washing, the moment one that has been described is going to be ethyl alcohol. That's a simple one-liner question that you had to analyze. There's one more question which falls in the similar lines, and that is regarding this drug. So quickly we'll analyze this also. A feeding mother is found to be positive for Mycobacterium tuberculosis. What is the drug of choice for the chemoprophylaxis that needs to be given to the infant? So obviously there's a feeding mother. Mother is positive for MTB, and now you want to know, because the infant has been in close contact with that feeding mother, the infant has been in close contact, so you want to give the infant something for chemoprophylaxis, and the answer to that question is going to be isoniazid. So you know, when is isoniazid given? When all, in what kind of exposure? Whenever children have a contact with someone who has active TB, or infants get in contact with mothers with active TB. So for children and infants who come in contact with anyone who is active TB, isoniazid is given as a prophylaxis. Similarly, if an HIV positive person, someone is anyway HIV positive, he's anyway at a risk of more infections, he comes in contact with someone who has active TB, you would want to start active prophylaxis right away. Also in case of latent TB, INH is what is preferred. So here close contact of the mother and the feeding infant was there. So clearly isoniazid is something that we would want to go in for. Well, with which we also wrap up our microbiology test and discussion. I hope you found it beneficial, and yes, do put in your feedback, and we'll be having many more classes on Unacademy like we always do. All the very best. Microbiology definitely happens to be a subject which has a lot of cramming up, so you know, you do need certain mixed bag discussions and tests, because they really help you in analyzing how much are you able to recall. When you're going topic wise, for obvious reasons you have a bias in your mind, but when you're going in a mixed bag, that is when the real test of your memory happens, that whether you've been able to recall all the mnemonics and the bullet points that you were mugging and cramming. So I hope you found it beneficial. All the very best, guys. Study well. Good luck. God bless you.